Sleeve gastrectomy, it's also a restricted procedure, namely that it gives you a smaller stomach. The way we achieve this is by removing a certain part of the stomach. And the part of the stomach that we remove in the sleeve gastrectomy is key. So we can remove anywhere between 70 to 80% of your stomach, making your stomach go from a football shape, for example, which can hold a lot of food, to more like a banana shape. The part of the stomach that we remove is called the fundus. And this part of the stomach is the stretchy part of the stomach that stretches like a rubber band, and it allows someone to eat a lot of food. In addition to that, the sleeve gastrectomy, during the sleeve gastrectomy, the fundus that is removed is also responsible for creating a hormone called ghrelin. And ghrelin is a hunger hormone. Basically, it makes you hungry. So therefore, when you do a sleeve gastrectomy, you reduce the capacity of the stomach or restrict the capacity of the stomach, and also control appetite or reduce appetite by decreasing the ghrelin production. But it is very important to know that that's where the similarity with the band stops. The sleeve gastrectomy, as well as the gastric bypass, it's considered a metabolic procedure. What does this mean? It means that the sleeve gastrectomy not only works because you're eating less and your appetite is controlled. It works also because it makes certain hormonal changes in your body that make certain diseases go away quicker and makes you lose weight faster. For example, when we do a sleeve gastrectomy in a type 2 diabetic, and I send the patient home 2 days later, I tell my patient, don't take your diabetic medicines until you measure your sugars at home, because your diabetes might have stopped by that time. And this is only maybe 48 hours after the surgery, and they haven't even lost 1 pound yet. Why does this happen? Because like I said before, the sleeve gastrectomy is a metabolic procedure. And by the nature of removing that part of the stomach, your body suddenly starts making more insulin, and you become more sensitive to your own insulin, therefore making type 2 diabetes go away or stop within days of the surgery in some cases. Just like any other surgical procedure, the sleeve has risk, and one of the main risks that we like to talk about is leaks. As you can see, in order for us to remove this segment of the stomach, we have to create a staple line, which is basically the line along where we cut and staple as we are removing the segment of the stomach. Leaks can occur at this site, and leaks can happen anywhere between 1 to 3% of the time. That is by far the risk that we talk mostly about, the sleeve gastrectomy. The other risk involve malnutrition. If you do not take your multivitamins twice a day like you are required to, over the years you can run into malnutritions like anemia, vitamin deficiency, or iron deficiency. In addition to that, with the sleeve gastrectomy, you can regain weight. There's no such thing as a perfect weight loss procedure. And weight regain among bariatric patients can be anywhere between 10 to 15% with any of the procedures, including the sleeve gastrectomy. Therefore, one of the risks over time is that someone can regain the weight that they lost, and therefore necessitate or need an additional procedure to help them lose the weight they have regained. Lastly, the sleeve is not reversible. The segment of the stomach, it's removed, and therefore the sleeve is considered a fixed procedure that we are not able to reverse when done in the traditional fashion. The Roux-en-Y gastric bypass is still one of the most commonly performed weight loss procedures in the United States. We first started doing gastric bypasses in the 1960s. So it has gone through a lot of changes to arrive at what we do today, which is namely a procedure that is done laparoscopically, using minimally invasive techniques with a 2 to 3 days hospital stay. As you can see, the gastric bypass has two parts or two components to it, really. First is a small stomach, which makes you less food, make you get filled quicker after a small meal. In addition to that, you can see that with the gastric bypass, we not only bypass the main stomach, but we bypass some small intestines as well. And depending how much small intestines is bypassed, this can cause someone to absorb less calories. So therefore, the bypass has two parts essentially. A restricted part, meaning you eat less before you feel full, and two, part of the intestines is bypassed, making you absorb less calories. What are some of the benefits of the gastric bypass? Well, one of the benefits first is that it's one of the oldest procedures. So therefore, we have the longest track record with the gastric bypass, and we know that it does work. And like I mentioned before, it's still the gold standard, which is used to measure any other new procedures. The gastric bypass gives you a fast weight loss. Most of your weight loss will occur the first 6 to 8 months after the gastric bypass. Therefore, a lot of the comorbidities or illnesses associated with obesity tend to go away quicker after a gastric bypass. The gastric bypass is a metabolic procedure, which means that your metabolism is affected, your appetite is reduced because ghrelin production is reduced, and that weight loss switch in your brain that I talked about before is changed, therefore causing a quick weight loss through its metabolic changes. The gastric bypass also has a benefit, or at least what I consider a benefit, which is called a dumping syndrome. Dumping syndrome basically means that it's a state where somebody that has a gastric bypass experiences lightheadedness, sweating, abdominal pain, and diarrhea after digesting foods that are high in sugars. What this does is that the dumping syndrome actually keeps people from cheating after a gastric bypass and keep them from consuming high sugary foods that can actually make them not lose any weight or counteract the effect of the gastric bypass. Some of the risks associated with the gastric bypass. One of the main risks that we also like to talk about is, again, leaks. And as you can see, we have a staple line as well in the gastric bypass, just like we do in the sleeve gastrectomy, and leaks can occur at these sites. Leaks, again, can occur anywhere between 1 to 3%. The other risk with the gastric bypass is more long-term, and you're talking about vitamin deficiency. Again, it's very important that a patient that had a gastric bypass take their multivitamins twice a day, including vitamin D and calcium, to prevent this deficiency down the line. The gastric bypass is also associated with weight regain. As I said before, there's no such thing as a perfect procedure. There's no procedure out there that a human cannot defeat, and the gastric bypass is one of them. Weight regain with the gastric bypass, again, is about 10 to 15%. In addition to weight regain, the gastric bypass is a fixed procedure, is not adjustable, and it's difficult to reverse. It can be done, but it's normally done as an open procedure and with difficulty.